Bismillahirrahmanirrahim. Assalamu alaikum. Hello and welcome back to my channel Diversity of Science. Today I'll be discussing about diabetes, which is very common in 1 in 10 people all around the world. So without wasting any further time, let's begin. Diabetes, as you all know, is a chronic disease. And by chronic, I mean that it doesn't occur in a short span of time, which means that it takes a lot of time for a healthy individual to be converted into a diabetic person. And in this condition, what happens is there is a buildup of glucose, also called as blood sugar, inside the blood higher than usual. So the normal mechanism goes like when food is converted into the glucose by a hormone called insulin secreted by pancreas, and that glucose is supplied through blood vessels through all parts of the body as nourishment. The symptoms of diabetes usually include being hungry, frequently urination, tiredness, wounds that heal slowly, always thirsty, and sudden weight drop. Some people have type 1 diabetes. This means that their pancreas doesn't produce insulin at all. And insulin is the key that allows the body to use sugar, also called as carbohydrate, in the form of energy. So people with type 1 diabetes need to take insulin several times a day through injection. Okay, so talking about type 2 diabetes. As mentioned earlier, in type 1 diabetes, the insulin is not produced by the pancreas at all. So in type 2 diabetes, the difference is that the insulin which is produced by the pancreas is very little in amount. By little, it means that it is insufficient for the body to be able to break carbohydrates into glucose and supply as energy to all parts of the body. And the reasons of this might be medicines, some pancreatic disease, stress, and being overweight. Now, coming towards the diagnosis. The first test is fasting plasma glucose test. In this test, you're asked to fast for at least 8 hours or usually overnight. Then, your blood glucose levels are tested by a blood draw, and then the readings are recorded just to know that you are a pre-diabetic person or in a diabetic range. Then there is oral glucose tolerance test. In this test, the pathologist will ask you to drink 75 ml of glucose and then ask you to wait for 2 hours. Then after that amount of time, the blood is withdrawn and the glucose levels are monitored. Hemoglobin A1C, also called as HbA1c, is the most accurate test. And why is that so? Because this test evaluates the average amount of glucose in the blood over the past 2 to 3 months. So what happens is, as I told you that there is a buildup of glucose molecules inside the blood of a diabetic person, then that glucose molecules binds to the red blood cells of the blood, and then they are found to be noted and recorded as high blood glucose levels in the blood. Diabetes complications. The first one is retinopathy that might lead to blindness, heart attack, peripheral neuropathy, which is referred to as numbness in the periphery region of the body, which are usually toes and tips of fingers. Then there are diabetic foot infections, permanent kidney damage, and cerebrovascular diseases, which means that there is a damage to brain as well. Maintaining a healthy diet is very important for a diabetic person to manage. So just following this method of diabetic plate, it makes it very easy. And what is this method? You should occupy half of the plate with low carbohydrate vegetables, and the remaining half should be divided into grains and protein portion. So the grains can also be substituted with starchy vegetables, with dairy products, and with fresh fruits. Okay, so as you all know that a diabetic person need to have at least 2 to 3 meals of snacks a day. So instead of munching something unhealthy, try choosing for something healthier, which means you have options for fresh fruits, nuts, wholemeal crackers, eggs, and low-fat plain yogurt. The suitable sites for insulin injection. Now there are actually 4 sites where you can inject insulin. The first one is the abdomen, the next one is the thighs, the third one is the arms, and the fourth one is the buttocks. Now these sites differ from each other in the rate of absorption that they offer. For example, the abdomen shows the fastest rate of absorption, and you can experience the effect of insulin in a very little amount of time, whereas the opposite is the case with the thighs. One thing you should keep in mind that you should also rotate sides, which is from right to left side, just to avoid swelling, because swelling also affect on the absorption rate of insulin. I think that was all for today. Thank you so much for watching. Don't forget to hit the subscribe button. Bye.